Hi, I'm Mark Takano. I am a U.S. Congressman, and I represent the 39th District in Southern California. And with me here is Mike Thompson, who represents actually Northern California. And we get along even though we're from different parts of the state. We don't talk about water all that much.
Or sports teams.
Or sports teams, the Dodgers versus, what's that team in San Francisco?
There's the one down where you're the Dodgers, and then there's the Giants.
The San Francisco Giants. Yeah. So Mike is also, I understand, he's a military veteran. He was in the Army and served a tour in Vietnam. I share along those lines. I'm not a military veteran myself, but I am the ranking member of the Veterans Affairs Committee. And I was a teacher before I became a member of Congress. And I learned that Mike is also was a public school teacher. But there's been a lot of veterans have been in the news lately. And Mike, you want to kind of talk about what you're thinking about, feeling about what's been going on?
Well, Mark, thank you very much for inviting me to your office to do this podcast. And it's very, very timely. I am a veteran. I served with the 173rd Airborne Brigade in Vietnam, and you're more than just the ranking member. You're a long-serving member of the Veterans Committee in the United States House of Representatives. You were the chairman when we enacted the PAC Act, which was the largest expansion of health care benefits for veterans in my lifetime, and I've seen firsthand. I'm a combat wounded veterans, so I know how important the VA is. But I've seen firsthand how the expansion of the PAC Act under your guidance really has improved healthcare services to veterans in my district. And my district is in Northern California. I represent the 4th Congressional District, and it's Sonoma, Napa, Lake, Solano, and Yolo County. We have a lot of veterans, and they count on the VA. They count on the expansion of services through the PAC Act. And today, I had a meeting with all the veteran service officers in my district, and they tell me that veterans are worried. They're worried, they're anxious, and it's all because of the chaos that's coming out of this Trump administration. And the latest news that they plan to cut 83,000 employees from the VA. And my veteran service officers know what this means. It's going to be harder for veterans to get their cases adjudicated. It's going to be more difficult for them to sign up for health care benefits. And veterans who rely on the VA for their actual health care are going to be hurt badly, because we're not going to have the health care providers because of these cuts, and add to that the other health care cuts that the Trump administration are bringing about are going to make it more difficult for the VA to hire health care providers. So it's a troubling time right now, and I just want to thank you for your continued interest in this and all that you've done.
Well, first, I always say two things to a Vietnam veteran. Welcome home. And thank you for your service.
Thank you.
I always get emotional anytime I say that to a veteran, whatever era. But there's something. I grew up during that era, and I was 10 years old in 1970. So I knew about the drawdown. I was 8 years old, 7 years old, 8 years old during the Tet Offensive. So, and I had an uncle who came. I think it's one of the reasons why I joined the Veterans Affairs Committee early on. I remember an uncle who came back from a tour, and he died by suicide. And I was 10 years old at the time. And so there was, and then I had 3 great uncles that served in World War II in the 442nd, 100th Infantry. And many folks who know about that unit know that it was a segregated fighting unit of Japanese Americans that served even as their relatives were in internment camps. So I feel in many ways that I am in Congress because of the sacrifice of that generation, in particular an uncle who died in combat in northern Italy. during World War II. And so I feel a deep, deep duty to pay it forward. And the PACT Act, a lot of the passion behind getting that done comes from that sense of gratitude.
Well, if I could just say, first of all, thank you for your family for their service. And I've always believed that military service is a family affair. It touches the entire family. And I'm very, very sorry to hear about your uncle who took his own life. And we know that's a huge problem right now with veterans. Veteran suicide far outpaced civilian suicide. And part of the Veterans Administration and the funding that they get and the hires over there make that, address that issue. And so when you take 83,000 people out, you cut services, it can't do anything but exacerbate a terrible situation.
So look, I want to return back to the PACT Act, but before we do that, there's another bill that I want to remind you that I authored, which was the Compact Act.
For mental health.
The Compact Act addresses veterans regardless of their eligibility for VA. So you may or may not be enrolled in, so people may not know that not every veteran is enrolled in VA, but the main thing you want to know is, that folks out there may want to know, is that regardless of your eligibility for VA, if you call 988 and press 1, you'll be connected to the Veterans Crisis Line, and if you have a mental health emergency, you will be connected with a mental health professional. You have the ability to go to either inpatient or outpatient mental health services. So if you're in crisis, in fact, anyone on this listening now, call 988, dial 1, press 1. And what my Compact Act did is it made it clear that you as a veteran didn't have to worry about pain, for the first 6 months of this. That your ability to pay should not be a barrier to your getting emergency mental health care. So before we even talk about the 83,000 potential cuts at VA, there were 2,400 VA employees fired, many of them veterans. I know many for a fact, and there were many more veterans fired across all of the federal departments and agencies. But we know for sure that people who work on the Veterans Crisis Line were fired. The Secretary Collins was very cagey and said that nobody who actually talks on the crisis line was fired. But supervisors were fired. Supervisors who are very, very critical to making sure that crisis line works. There were people who have a different job title to the young 18-year-old, 20-year-olds that working on Doge, their job titles sounded like they were expendable. But it turns out that there are people who aren't necessarily talking to the veteran, but who are listening in and who are communicating with the first responders, so to make sure that the veteran can, is safe in other ways. So I mean. What I'm trying to say is that these 2,400 person cuts, they weren't all thought out.
No, they're being loose with the truth, and I heard that from my VSOs today. They have a lot of contacts, colleagues, and friends in the veteran space, in the VA space, who are leaving. They're looking for other jobs now because they don't feel that the job situation and the way they're being treated is dependable employment, and they're worried about that. So it's going to have an impact on people who are cut and people who are just part of the units that are cut, and it's going to create a disincentive for people to come to work for the federal government.
So, we could talk a lot about this for a long time, and I believe it boils down to that this secretary thinks the VA is fundamentally broken and wants to destroy veteran health care. That's going to be the net effect of all these really experienced people leaving. A
lot of our Republican colleagues want to privatize the VA system. They've wanted to do that for a long time, and that carries certain dangers as well. I hope that veterans in the red congressional districts let their voices be heard, because truth of the matter is, in the minority, there's only so much you and I can do.
Right.
We need Republican allies, and people who live in Republican congressional districts need to sound off.
Well, and we know that you and I have Republican friends here, at least people we talk to, who are getting very skittish about this 83,000 person number that they want to fire. Why don't we turn toward another topic about education? And you were a teacher, and I was a teacher, and what did you teach, by the way?
Well, you know, when I got back from Vietnam and got out of the hospital, I worked a little bit at home in the wine industry, and then I went to community college because I hadn't finished my education before I went into the service, and then I transferred from Napa Community College to Chico State. The Harvard of the CSU system up in Chico, and I studied public administration and economics, and then after finishing my graduate degree, I went into graduate school, and I taught at Chico. I taught in the political science department. I taught public administration, and then I also taught at San Francisco State, where I taught state government there.
So you taught in higher ed.
Correct.
Well, we know that what's at stake with the Department of Education, student loans, Pell Grants, and the K-12 educational system. We're talking about special education, Title I funding, Donald Trump has made it very clear in his campaign that he wants to basically destroy the Department of Education. He wants to get rid of it.
He's doing it. He hired somebody specifically to disband the Department of Education. And I think that everybody should be concerned about that, because the federal Department of Education, they establish a standard. So if you're in your district in California or my district in California, and we're hiring people and they're coming from states that have lower standards than our state, with the State Department or the Federal Department of Education, you at least have some normalcy, some standardization.
Well, they look at they do lots of important research, gather statistics on the best practices,
Right.
And they help the most vulnerable kids out there, the kids that have. So educational performance is a lot tied to income, and so Title I is about getting extra resources to low-income kids to help them get to grade level reading. Special education, actually, because of special education law, which we created in DC, it means that every kid out there who has special education needs, gets an individual education plan, and every school district's held to a certain level of standard and expectation about making sure those kids get their right to an education, a public education, met. And I've never heard, I don't know if you've ever had this happen, but I've never seen a local school board official, Republican or Democrat, come to me and say, we don't need more special education money. They're usually coming in and say, fully fund special education.
As you know, we've never fully funded it.
We've never.
And I hear that a lot throughout my entire district. I know you do. I can't imagine another member of Congress not hearing that from home. So there's more that we could be doing from the federal level. We don't need to do less.
So I sense that they've done polling, it's very unpopular to take out the Department of Education. Americans want education improved. All this talk about sending it back to the states is a bunch of hooey, because frankly, local school boards and states do most of the funding. They have most of the authority, but what they need the federal government to do is to make sure that we establish the best practices, that we make sure that the neediest kids have enough funding, that they have school lunches, that they have the ability to learn because their stomachs aren't empty, and that special education, funding is there to help school districts. It's very expensive to do special education. Finally, let's let's move to the
There
topic.
used to be a popular bumper sticker in California.
Which
It
one?
said, if you think education is expensive, try ignorance.
Well, yeah. Let me say, the final topic is on Medicaid. And I don't know about your district. In my district, I know that 1 out of every 3 people depend on Medicaid.
The whole state of California.
Same thing, right? All up and down the state.
Yeah.
Probably half the kids.
Yeah. I have one county that's 54% Medicaid.
Wow.
And so it varies. There's some richer areas and there's some poorer areas, but the number for this entire state is a third.
And Medicaid is what is the health insurance that people depend on, and it's not. I mean, it's very popular. We're learning that it's very popular with people. That it's not just thought of as insurance for low-income people, but it's also the middle class depends on it because if they have an aging parent that needs long-term care, Medicaid is often who pays for that long-term care.
Yeah, and it's not just people who are unemployed who will be harmed by this. If you take a third of the funding out of the healthcare structure in any county, that's going to mean that the entire healthcare delivery system suffers. So if you get your healthcare through Medicaid, Medicare, private insurance, or you have a pocket full of money and you pay cash for it, you're going to be hit. Because at best, what will happen is everybody will just reduce the services they provide. So if you've got insurance or you're rich and you've got a lot of money and you show up at the hospital for a particular type of procedure or service, and they've had to lay those people off to deal with this loss of Medicaid, you're not going to be able to get the health care that you need. People are going to put off health care decisions longer, and rather than taking care of them when they're in the first stages and they're cheaper to deal with, they'll put them off until they're acute and more expensive.
That's a really important point you're making there, that if we know that 1 out of every 3 people in our communities, that their insurance is about Medicaid, that losing that would have ramifications on the entire healthcare infrastructure. That's just a big revenue hole that would damage the healthcare system for everybody, including the people at the upper end.
And there's ancillary services that Medicaid pays for as well. I have a constituent who is on the state IHSS board. She's very active in the community. She lives at home, and she's able to do she has a job. She's able to do all of that because through Medicaid, she gets a wheelchair, a motorized wheelchair. And if that Medicaid funding goes away, she won't be able to get around. She won't be able to live at home. She won't have a job. She won't live at home, and she'll be in a much more expensive place for the taxpayers to deal with.
Let's make one thing. I want to just clarify something. We're both Californians. Medicaid in California is called Medi-Cal. In my own county, you have several counties, sounds like, in your district. I have just one. Medicaid would be known by the Inland Empire Health Plan or Molina. Those are the 2 managed care systems that take all the Medicare patients. What do they call it in your region?
Well, it's Medicare. It's Medicaid funding from the federal government. It's Medi-Cal at the state level, and we have several different
ways it's known by. Because there may be some folks out there who I don't get Medicaid, but in fact.
It's kind of like people who said they hated Obamacare, but they loved the Affordable Care Act, and it was the same thing.
It's the same thing. It's the same thing. Yeah. So, I'm going to say that I would say that Medicaid played a big role in increasing the number of mental health providers and substance abuse. People who have alcohol treatment centers. These have all been made possible because people have been able to enroll in Medicaid, and Medicaid helps to pay for these kinds of services.
And the thing that I'm hearing is if that part of the funding goes away, which it will, you can't take $880 billion out of that budget space and not impact those. But folks who are in alcohol programs, drug programs, maybe domestic violence programs, they're going to go into the criminal justice system, and it's going to be much more expensive for taxpayers.
Well, thank you, Mike Thompson.
Thank you, Mark
for this conversation. And you know, we're in the fight together to protect Medicaid, to protect our veterans, and to protect education.
Absolutely, 100%.
Thank you, brother.
Thank you.
Thank you.